Welcome everyone to today's podcast. We're going to talk about type 2 diabetes from prevention to management. Please welcome with me Dr. Yasir Zarouk. Dr. Yasir is a family physician and diabetologist, researcher in metabolic medicine and obesity. Welcome, Dr. Yasir.
Assalamu alaikum. Hello everyone. Wish you really have a nice day today. And it's my pleasure as Dr. Yasir Zarouk, Professor of Metabolic Medicine and Diabetology expert and physician in primary care. It's my pleasure to present today some information about type 2 diabetes.
Okay, so doctor, can you please tell us more about type 2 diabetes causes and symptoms?
As you know, many of chronic disease right now, it's being too much spreading among populations globally. Many of our patients right now, they are unaware they are having type 2 diabetes, and about 700 million people globally having type 2 diabetes. So we need to highlight the causes behind this. As based on these studies, many of etiology behind this is a combination of hereditary or genetic factors. It's really about 25 to 30%, and environmental factors like sedentary style, who's staying inactive for long times, and about foods, and especially high carb foods. It's really affecting our situation. And also there is many factors like smoking, presence of hypertension, dyslipidemia, a lot of stress. As you know, right now most of our people, they are having stress, anxiety, and their mental health is not stable because of many situations, as you know, and crisis all over the world. So what we can do to say yes, we have type 2 diabetes, as you know, we need to, once we finding some signs, some features on ourselves, we need to check as soon as possible. First of this is loss of weight. That means your weight is reducing more than 6 to 10 kilo within the last 3 months. So we need to check about type 2 diabetes. Second point or features we are seeing in many patients is the presence of polyuria. That means too much frequency of urination and going for bathroom, morning and at night during sleep. Third point, it's feeling hunger and having this hungry situation, and you need to eat too much. And once you eat, you still have feeling of hungry. That means there is insulin resistance, and this situation usually coming with type 2 diabetes. Fourth point, we are seeing it's patient or our people, sometimes they are obese and they are having this acanthosis nigricans. It is a skin change, darkness of skin, especially over the neck, this right side or left side or even back side, and on the chest or abdomen, even back, you can see. So once you have one of these features, please go for your doctors and check blood sugar, hemoglobin A1C, fasting blood sugar, and checking urine. This really recommended, and it is very famous situation we are having nowadays. Wish you have a best of health.
We often hear about pre-diabetes. At what exact point should a patient recognize they are in the danger zone, and is it truly reversible?
Thank you for this nice question about pre-diabetes. What does it mean by that? As you know, the clinical history or natural history of diabetes, it is about 10 years before symptoms being clear and obvious on our health. This 10 years before, there's many metabolic changes, genetic changes, and a lot of process that's happening in pancreas and liver and even in other organs like muscles, and insulin being insensitive, and pancreas feeling tired, and by the end it will be reaching the level of failure of pancreas to produce enough insulin, and the cells like muscles and liver being insensitive to this amount of less insulin, and by the end, the final process, it will be type 2 diabetes features like loss of weight, polyuria, polydipsia, feeling thirst, and tiredness. All of this happening after about 10 years of process of metabolic changes. So during this process, the situation is called pre-diabetes, and usually our patients, they are asymptomatic, they don't have features, they are feeling well, they are practicing their life without any problem. So once we have risk factors for type 2 diabetes, as I told you before, if there is family history, if there is hypertension, if there is any personal history of chronic disease, chronic medication use, so we need to check each year or each 6 months, we need to check blood sugar just to confirm the situation is under control. So for pre-diabetes, based off studies right now published, like UK BDS and prevention program by US, or some studies in China, they are showing that pre-diabetes is really a reversible condition. How to reverse pre-diabetes situation? It's just by doing lifestyle changes. It means many things. Increasing exercise about 150 minutes per week. Also reduce carb intake as much as you can, especially this fast amount of carbohydrates or rich carbohydrates like beverage, chocolate, sugar, white sugar. We need to take care from this as much as you can. Reducing weight, very important. If there is loss about 10% or 10 kilo of our weight, there is reducing the percentage to have this pre-diabetes in the near future, maybe reaching high percentage or completely reversible. Also, diet control, as I said. Sleeping well, very important. We have to sleep every day about 7 to 8 hours. It will help us too much to be in safe side. Less sleep, like 3 to 4 hours, increase incidence of type 2 diabetes. More sleep, more than 8 hours, also increase incidence to have type 2 diabetes. So we need to make a control of sleeping and make it as optimal amount of sleeping. Then our body will be healthy and can control these metabolic changes. Pre-diabetes diagnosed clinically by lab findings, based on lab findings. Usually run the blood sugar from 140 to 199 milligram per deciliter, HbA1c 5.7 to 6.4%, or fasting blood sugar 110 or 100 to 126, 25. This is the limit, upper limit. Then we can see we have pre-diabetes. So the issue, it's reversible. It is a common nowadays, and most of our patients, they are unaware they are having pre-diabetes state. So please, if you have a risk factor, as I told you before, go for your near clinic and check your blood sugar.
Signs of diabetes and workup that should be done immediately.
Once our patient having these symptoms and signs that we talk about, like loss of weight during the last 3 months, okay, feeling tired, drinking too much water and feeling still thirst after drinking, and going for bathroom too many times during morning, during evening, even during sleep, sometimes getting up, walking by this feeling to go for bathroom. All of these features once coming together, so we need to check first of our work up as a physician or a doctor, just to check blood sugar. We need to rule out the presence of diabetes, and then we think about other conditions. So once we have diagnosed type 2 diabetes, what we can do, the advice from American guidelines, American Diabetes Association guidelines 2026, European Association of Diabetes Study, Canadian guidelines, and our local guidelines here in Gulf countries and in our Arabic countries, and Ministry of Health, they recommending doing one of 3 tests to say we have type 2 diabetes. Any of these tests, it's really quite enough if we have symptoms. If you don't have symptoms, we can do 2 tests to confirm the situation, or repeating the same test in 1 or 2 days apart. What is the test? Usually random blood sugar, checking through this glucometer machine and finding the blood sugar. If it is blood sugar coming like more than 200 milligram or per deciliter, or more than 11.1 millimole per liter, it is type 2 diabetes. Okay, if it's then fasting blood sugar, it means 8-hour fasting from eating and drinking. You can drink water, it's allowed because water have no sugar inside, it's okay. So once we have drinking fasting blood sugar coming result more than 126, it is diagnostic, and it's really giving diagnosis of type 2 diabetes. The third test that we can do it easily in our labs, it's glycated hemoglobin A1C. It's very important to do it. It's really giving us accurate diagnosis for our patient. If the result is more than 6.5, it is diagnostic. If the patient have no symptoms, as I mentioned before, we need to repeat the same test or other test as soon as possible to say yes, we have diabetes, or not, we still not have diabetes. Once we make diagnosis sure 100%, we need to start medications, lifestyle changes, and making a plan. And this plan should be individualized between doctors, physician, and each patient, and should be clear, straightforward, with agreement and with passion between doctors and patient, because each patient it's really different from other patient. No one thing can fit all. This is the rule. It's really true when we're practicing and based on recommendations by all guidelines. So, but usually we start by 2 medications. This is a more accurate and more helpful to control blood sugar and protect. This is very important. We need not only controlling blood sugar, but also we need to protect heart, blood vessels, kidney, and retina and other organs. It's very important. In treating diabetes, we don't only focus on management of numbers of blood sugar. We need to protect other organs from getting failure, from getting more problem, like chronic kidney disease and renal failure. We need to protect, like heart problems, angina and myocardial infarction or even cerebrovascular accident. We need to protect other organs, like problems related to food and retina, retinopathy and blindness. We need to really check these organs, they are fine. So in treatment of type 2 diabetes, we are not treating blood sugar. We are treating whole organs for whole life. So we are caring about many things, and the plan looks like starting with medication, 2 types of medication usually. Metformin is a drug of choice, the golden drug. About more than 60 years it's keeping the track. And the other drugs is SGL2 inhibitors. It's very important, protecting heart, protecting kidney, and controlling blood sugar, like dapagliflozin and empagliflozin, 10 milligram or 25 milligrams. They're very important, very nice. And now it's recommended as the first drug by NICE guideline, by American Endocrinology Society, by many guidelines as the first choice, and should be combined with glucophage unless patient having side effects. We can manage, we can add other medication is based on this situation. This is the first line. The second line, we can add other medication like GLP-1 as Ozempic, Mounjaro as second option. Also, we can add sulfonylurea based on patient. If he's really not controlled still, we can add, or we can start by insulin from start if the patient willing, and we need to check availability of insulin, there's access, patient can buy it, and the cost is acceptable. All of these things we put it in our mind, and wish you have a nice health, and we are keeping checking and tracking blood sugar through HbA1c, symptom and signs, blood sugar, lipid profile, and all of these things, cholesterol. We need to check every 3 to 6 months based on first readings of blood sugar.
With the massive global rise of newer medication like GLP-1, these changed your day-to-day management strategy. So please talk to us more about it.
The impact of GLP-1 on type 2 diabetes practice. As you see right now, we have this revolution of new medication like GLP-1, and it's really affecting our life day by day. And how is this affecting? It's really reducing blood sugar too much, and many studies have been done, like step up studies, surmount studies. All of these studies really showing that when you're starting by small dose like GLP-1 of some of these like semaglutide, Ozempic, Wegovy, or Mounjaro, tirzepatide, GLP-1, GIP-1 medication, or even tirzepatide right now, this by Eli Lilly company. All of this medication really changing our practice. Now we are less using insulin because of this medication have many roles. First, reducing blood sugar, making glycemic control too much and very fast. Second, reducing weight loss amazingly and nicely. And third, it's really reducing fatty liver changes. And this is very important to keep the health of liver for a long time and improving insulin sensitivity and actions. And also this medication protecting heart from major cardiac events like myocardial infarctions, and even reducing the incidence of heart failure, especially heart failure of desired ejection fraction or HFpEF. When ejection fraction more than 40 and even 50, it will be amazing when using this medication. And also you have many roles like obstructive sleep apnea, it's improving their life, and even patients with depression or anxiety disorders, and whose puppies, they really improving their life and practice and mental health. So this revolution of GLP-1 medication is really like a new change in our practice and recommended in many guidelines. Last guideline published last month in May 2026 by NICE guideline. They really recommending GLP-1 as a medication with SGL2 or without SGL2 if there is contraindication for SGL2 inhibitors. And it's really amazing to see this happening right now, and willing to see in future this medication having less cost and the access is easy for all the people to keep health equity for everyone.
What are the long-term complications of uncontrolled diabetes that concern you the most, and how early do they actually begin to develop?
Thank you for this nice question about the complications of type 2 diabetes and when it happened, and how much of these complications affecting our life. So as you know, diabetes is a chronic disease, and the remission, it's not happening once the diabetes diagnosed in most of patients, but at minority of patients, yes, it can be reversible. It can be there is remission for some cases, and there's criteria about that. Once the patient is obese or morbid obese, BMI more than 40 or 35, and newly diagnosed, the pancreas producing amount of insulin is considerable and good. And what we can do, just reducing weight as much as you can, making tough lifestyle changes on reducing too much amount of carb intake, increasing exercise, and keeping strengthening exercise to keep the muscle working well, to take all of this amount of glucose inside the pot. All of this measurement, and then after 3 months we can stop medications and keep follow-up every month until 3 months. And once we are finding the blood sugar is normal and not affecting after stopping medication, then we can see there is complete remission of type 2 diabetes. But this is a criteria, not everyone, but majority of patients, they are coming late on diagnosis, and their diabetes usually coming sometimes with complications and no way to stop medication, no way at all. Whoever advising to stop medication is really cheating our patient and sharing fake news. Take care from that. Okay, what is the complication that we are really seeing in our practice? Most of these, they are starting usually by retinopathy. You know, retina in eyes, usually the first organ that having this problem, and we need to check it every year, annual checkup, just to confirm there is no changes on retina, and the optic nerve was making this vision, light vision and color vision, everything is fine, and we need to check by ophthalmologist each year. And sometimes if there's problem starting, we need to check maybe every 6 months or 3 months even, and starting some management if the problem started. The second point or second complication that I would like to highlight, it is a kidney failure or CKD, chronic kidney disease. This is a very common, and we need to check creatinine level and eGFR and albumin creatinine ratio. Each patient who is diabetes should be every year having this test, albumin creatinine ratio, and the ratio should be less than 30 milligram per gram, less than 30. If it is more than 30 until 300, it means there's microalbuminuria, and this are signs of damage starting the kidney. If it is more than 300, that means a macroalbuminuria, and that means there is severe damage already happening and happened on the kidney, and we need to do urgent management to preserve the kidney from further damage. Okay, third organ usually affecting by diabetes as nerves, especially peripheral nerves on legs. It's very common to have diabetic septic foot. It means like any small injury on leg. For those who's wearing shoes, open shoes, not medical clothes shoes, really they are coming with silent wound and injury on their legs, and it's difficult to treat, sometimes taking 3 months or 6 months with drainage, with wound care every day, but it's still not improved well because of this situation. Diabetes affecting nerves, making our sensation for injury, for trauma, for scratching things is very little. And some people, they are painless, they don't have pain. Okay, the fourth organ also affecting by once this complication type 2 diabetes, it's heart and blood vessels. As I told you, heart's usually affecting by diabetes, and people with diabetes having high incidence and high rate to have heart failure, to have myocardial infarction and closure of coronary arteries. This is very common. So take care from diabetes, really a major risk factor. And as WHO statistics, they are showing that the 7 cause of amputations is diabetes. Maybe the 3rd cause of blindness globally is type 2 diabetes. The first cause of chronic kidney failure is diabetes. All of this problem is just behind of that uncontrolled type 2 diabetes. Once we mean uncontrolled, that means the health patient not feeling well, is having this tiredness, not doing his daily activities well, not sleeping well, affecting our sleep, he feeling tired. And also based on lab test, there is abnormal HbA1c, random blood sugar or fasting blood sugar, and also affecting our daily life and practice. Once we have uncontrolled type 2 diabetes, we need to make it controlled, because the process and the damage will start. And this may be taking years to see this complication development. So usually take care when we have type 2 diabetes. And yes, once we are controlling it, it will be fine. Diabetes is a nice friend. Once you treat him well, he will treat you well. Once you ignore it, the problem is starting. Wish you have a nice day.
Thank you so much, Dr. Yasir, for this informative session, and we are looking forward to more and more episodes with you about type 2 diabetes, and we were very happy and pleased to have you today.